Very quickly, I'll talk about our centre. It was created in 2009 with funding from Industry Canada. And the purpose of our centre was really to look at how health sector innovation can improve care and patient outcomes, but also how it could contribute to economic growth and development in Canada. And the emphasis of our work has really been on innovation adoption. Our innovation mix, and this is the way we do work at the centre. We essentially have 3 lines of business, as we call them, and the first is our health innovation projects. And these are really applied research studies that look at the implementation of innovation within the health system and really focuses on the enablers and barriers of innovation adoption. The second line of work is leadership development and education, and we do this through formal courses in education, but we also do it through engaging interdisciplinary teams on the health innovation projects, so they get applied hands-on experience, and finally through the contribution of knowledge-based, finally to the contribution of the knowledge base through developing various publications. Much to John's point earlier, we learned very early on, in order to have effective innovation, you need to bring all of the partners to the table from the onset. So when we bring together our innovation projects, we bring together the private sector, who's often the innovators and often develop the innovations, the health sector, which also entails patients and their families, but also providers, who are often the users of innovation and the adopters of the innovation, the policymakers, who really fundamentally create the conditions for innovation, and then of course the academics and researchers, who can assess and evaluate in a neutral way. But that's enough about us. So let's take a look at some of the global and economic demographics and some of the trends that are shaping the health innovation landscape. Most countries around the globe are facing enormous pressures to manage the rapidly increasing costs of healthcare. According to a recent report by Deloitte, a total global health spending was expected to rise on average 5.3% over the next 3 years. This growth will place enormous pressure on governments, on healthcare sector, delivery systems, insurers, and consumers, both in developed and emerging markets. And this is really going to force us to have to deal with emerging issues such as the aging population, the rising prevalence of chronic diseases, soaring costs, access issues, as well as disruptive technologies. According to CIHI, in the last decade, health expenditures in Canada have doubled from about $100 billion to $200 billion, and this is largely due to investments by federal, provincial, and territorial governments in the sort of mid to early 1990s. In 2013, Canadian healthcare expenditure was 11.2% of GDP, which amounted to approximately $211 billion. Total health expenditures per capita during that time was $5,988. And of course, this varied across the country, with Newfoundland and Labrador and Alberta spending more, and places like Quebec and British Columbia spending less. Among OECD countries, in 2011, which is the last time the data was available for this, Canada was among the top quartile of spending per capita per person spending on health, and with our neighbours to the south, of course, spending the most. And while the rate of healthcare growth spending seems to be increasing, it is slowing down overall. In 2012 to now, the increase was only 2.6%, and this is after years of 7% growth. And this is probably a result of concerted efforts by governments across the country to control spending and really bend the cost curve. Again, according to CIHI, in 2013, spending in hospitals grew by 2.6% to the total of approximately $63 billion. Total spending on physicians also grew by 3.6% to a total of approximately $31.5 billion, and then total spending on drugs, and you can see the number up there. While it's keeping with the overall trend, the growth in spending on hospitals and physicians is slowing down. However, physician compensation continues to be the fastest growing category of health spending in the country. And again, similarly, while drugs are also accounting for a declining share of total health dollars, we are down, not very significantly, but we are still down from 16.8% in 2010 to 16.3% in 2003. When it comes to global demographics, the current world population is approximately 7 billion. The global population over 60 or above has tripled in the last 50 years, and it is expected to triple again in the next 50 years. Here at home, the Canadian population is also aging. I know that John provided some specific numbers around that, and seniors do make up the fastest growing age group. This trend is continued to continue for several years, mainly due to replacement fertility rates and increase in life expectancy, the aging baby boomer population. In 2051, 1 in 4 Canadians is expected to be over 65. When we look at boomers as consumers of healthcare, their impact is profound. And while the stats are Canadian on the slide, I think when you think about it in a bigger context, baby boomers, for example, are responsible for half of all consumer spending in the United States. And 4 million boomers will retire each year for almost 2 decades. There's no denying the fact that this has profound impacts on healthcare in our country and around the world. Chronic disease, again, something that John touched on. Globally, we're seeing an increase in chronic diseases such as heart disease, stroke, cancer, chronic respiratory disease, diabetes, and mental health. Chronic diseases are by far the leading cause of mortality in the world, representing 63% of all deaths. Cancer and heart disease are becoming major killers even in the emerging market. And the increase in chronic diseases can be attributed to a number of items, including the aging population, sedentary lifestyle, dietary changes, and rising obesity rates, as well as improved diagnostics. In Canada, chronic disease rates are also rising, and so are the number of deaths due to chronic diseases. Chronic diseases are rising faster among Canadians between the ages of 35 and 65 than they are in Canadians over the age of 65. 3 out of 5 Canadians older than 20 have a chronic disease, and 4 out of 5 are at risk. And there are more children today being affected by chronic disease than previously seen in adults. I have to say there's a lot of numbers in my slides, and I haven't had my full cup of coffee, so be patient with me. Moving right along, with all of these demands and pressures on healthcare systems around the world, people are really looking for innovative solutions to address some of these, but to really meet the needs of their populations and also ensure sustainability of their health systems. So what is innovation? At the center, we define innovation as a new or better way of doing valued things. And our definition is really a machination of a number of definitions, including that from the Council of Canadian Academies. The key word here is really valued, because it means not only just looking at economic value, but also looking at what's really important and of value to health systems and populations. Innovations can be products, processes, or systems, and an invention is not an innovation until it's been implemented to a meaningful extent. So how does Canada do in innovation? Based on OECD indicators for innovation, we rank 14th out of 17 when it comes to innovation. And despite being an exceptionally educated population, we fall behind in a number of areas, including public and private expenditures and investments in R&D, patents filed, and the ease of entrepreneurship. According to the Conference Board of Canada, despite a decade or so of innovation agendas and prosperity reports, we remain near the bottom of our peer groups on innovation. And typically, we don't take the step that other countries do to ensure commercialization and adoption that can be used as a source of competitive advantage in the global marketplace. In 2012, our center did a white paper on strengthening health systems through innovations, lessons learned. We looked at 7 OECD countries to identify their experiences in transforming health system and some of the innovations that they undertook to reform their health system and to identify opportunities for Canada. The 7 comparator countries we looked at are the UK, Australia, Germany, the Netherlands, France, Switzerland, and the US, countries that we often are compared to when we talk about quality of health care and we talk about outcomes. Each of these 7 countries have demonstrated with some measure of success innovations that have helped improved outcomes and also sustained health system costs. Some of those trends and have been broadly categorized on this slide. And what I'm going to do is I'm just going to spend a few minutes walking through each of these. So the connected consumer, and this could be the empowered consumer, and this could be the engaged consumer. I'm choosing the word connected just because I think there's a huge role of technology here, but it could be interpreted in a number of ways. Canada is a highly wired society. We were early adopters of internet and broadband, and we're one of the highest internet penetration rates in the world. With nearly 8 in 10 Canadians online, many of those users are online daily. We're within the top quartile of countries using the internet. 70% of people between the ages of 55 and 64 use the internet. 48% of people who are 65 years of age and older use the internet. Compared to other countries, we spend approximately 45 hours a month online, and a large majority of that is spent on social media networking sites like Facebook, Twitter, and LinkedIn. 67% of Canadians who use internet and social media sites, 67% of the Canadians who use the internet use social media sites such as Facebook and Twitter. 43% of seniors, 65 and over, use social media, and the most prolific social media site for seniors is Facebook. On average, Canadians spend approximately 10,000 minutes or 7 full equivalent days on Facebook. And females are more likely to use Facebook, and they are approximately of the age of 35. I would like everybody to know I am not on Facebook, so I'm not a part of this statistic. So moving from the internet to the mobile sector, the digital mobile industry is growing exponentially, both within Canadian markets and global markets. With 56% of people who have smartphones. I'm not going to read the stats on this, but I would be very curious to see how many times people in this room check their phones, because that number to me is astounding. Despite the booming smartphone market, only 34% of seniors 65 and over report owning a smartphone, although 61% of seniors do report owning a cell phone. And I think that's a really important distinction to be able to make. However, Deloitte does predict by the year 2020, the gap between the 55-plus consumer market and those between the ages of 18 and 54 will be negligible. And by the end of this year, the 65-plus age bracket will have close to 50% penetration of smartphones. And this brings us to mobile health. And mobile health, for the purpose of my presentation, is really basically defined as the use of wireless tools, smartphones or tablets, to access and deliver care and health information. The mobile health application market has also exploded. Currently, it was estimated there's 97,000 health-related applications, and this is a figure from last year, so I anticipate that has grown significantly. And the apps can really be broken into 3 areas. The first is monitor and tracking types of apps. The second is coaching and training. And the third is decision support. By far, the 3 most popular types of applications across platforms, which is both Apple and Android, are related to weight loss and exercise. And increasingly, 71% of seniors have downloaded an app on their smartphones. And if you consider the fact that there's approximately 2 million apps there, and if anyone has navigated an app store, it's not an easy thing to do. So I think that's really impressive. At the same time, while they're downloading apps, it's also important to recognize 2/3 of them will not have used mobile instant messaging, which is the most common form and widely used app-based service on smartphones. So you've got a bit of a mix of what they are using and what they aren't using. And next we have wearables. So think of smartwatches and health monitors and pedometers, and they're all part of the emerging landscape of wearables. And wearables are embedded into items that attach to the body, so your head, your feet, your wrists, your arms, and they can resemble anything like glasses, watches, clothing. I'm watching someone at that table shaking your head. These wearables are really created to capture data or present data. And the data could be as simple as the number of steps you take in a day or as complicated as an ECG measurement. And wearables convey information through a variety of means, and it could be as simply as a Fitbit reporting through a flashing light how many steps you've taken, or it could be more complicated as a display on a tablet or on a phone. I think when you look at the numbers of wearables, you can see that there's significant growth in this area. So what does all this mean? the trends are driving consumer self-management, and we're really creating a very active, informed, and selective individual who have different expectations of their health systems. It's a changing dynamic between patients and providers, as well as payers and patients. So all of the traditional relationships as we know them in the health system are evolving, and we're now seeing the technology and information-empowered consumer. Similarly, we have now abundant evidence and information going to providers almost in real time, which means the way they deliver care and the way we think about delivery models also needs to change and evolve. And the next two things and the next two trends that I'm going to talk about, including virtual care, will demonstrate that it's time for us to rethink how we deliver care and how we our policies around reimbursement models and the way we educate and train people going forward. So virtual care is really about moving beyond the bricks and mortars of healthcare delivery, and it's essentially about bringing care closer to home, if not into people's home. Virtual care, like many of the things that I've talked about, can be defined in a number of ways. For the purpose of my discussion, it's really about the integration of telehealth or telemedicine initiatives in care delivery, and it can complement or substitute care depending on the needs of the individual. Virtual care will enable professionals to collaborate with each other and deliver care remotely, and this means that providers can collect patient data from a different location from where the patient's actually at. Based on emerging evidence, and the evidence that I looked at was largely US-based, virtual care solutions are starting to suggest that they can help to address some of the challenges that we're facing in health systems, including issues with access, providing a better patient experience, better patient outcomes in some instances, and then reducing cost and utilization. Among the wide range of virtual healthcare tools available, the evidence that I looked at suggests that there's significant opportunity and potential for things like virtual visits, virtual consults, home and remote monitoring, remote ICUs, and remote ECG monitoring. I know there was recently a report in Ontario about the virtual ward, which doesn't necessarily technology enabled, but again, the same type of concept, which is really moving out of acute care and making better use of some of the technologies we have. There are also a number of other virtual health initiatives, such as telerounds, telepharmacy, and telehome health, that are more in earlier stages of adoption, and the evidence has yet to definitively show results, both from an economic perspective, but also from a patient health outcomes perspective. Interesting quote by Dr. Ed Brown, the CEO of Ontario Telehealth Medicine, predicting where we will be by 2020 in terms of virtual care. And then I thought I would share this because I thought this was really interesting. PwC in 2013 did a study with 2,500 Canadians, and it was a 3-week study, and it was an interactive research study where these individuals were educated and informed about things like mobile health and virtual health. And they were trying to really get to the answer, what does the future of healthcare delivery look like in Canada? Some interesting findings include, in addition to what you have on the screen, 54% of Canadians indicated that they would be comfortable having post-surgical visits done by video conference, and the majority noted that virtual visits, home monitoring, and virtual wards are good care delivery options. And then 63% indicated that virtual care would actually enable them to provide care for somebody else, like a child or an elderly patient. The need for virtual care has really stemmed from the demand for services and the need to provide acceptable and affordable care. However, in order to adopt virtual care or any of the innovation that I'm sure we're going to be talking about today, we really need to go back and rethink and redesign our health systems. We need to think about our policies, we need to think about reimbursement models, and we also need to think about how we're educating future generations of providers. And then finally, this brings me to personalization. And in the traditional sense, we always think about personalization as tailored healthcare services and treatments to meet the unique challenges of a particular disease or condition for an individual. However, today, the access of information alongside the revolutionary discoveries that are being made are creating a demand for personalized healthcare designed around the goals and the needs of the individual. And this access to information and shifts in consumer behavior preferences are really creating the demands for a different kind of personalized health system. And when we look at omics, we've seen that we've made so many significant advances in what is possible, and it remains to see what we can do with genetic mapping and with identifying specific markers for illness. However, the rapid evolution of information and communication technologies has also changed the role of the consumer in their own healthcare plan. Consumers are now going to their appointments with pages of printouts and information and their own goals. I mean, think of Dr. Google. And this is really creating a consumer-based system where people are actually selecting what tools they want to use online, how they want to use their tools to really personalize their own health and wellness needs, but also to engage clinicians and providers in a two-way dialogue of what those needs look like. And it's no longer just about clinical outcomes. It's about patients identifying sort of the larger things that they want and the quality of their lives. One of the challenges with some of these apps is that they're actually not connected into the more formal system. So people are carrying this information on their devices and there's no real connectivity, so providers actually don't have access to this information, and that's one of the challenges. So I know that John had spoken about some of the challenges with technologies, and that's one of the things that stands out for us as we think about where the future is going. So there's a perfect storm brewing right now between on the demand side, where we're asking more of our system and there's more pressure on the system, plus what we have, the shortages that we're experiencing on the supply side. There's so many more technologies, and the question really used to be about three things. One was adding more money to the system, which we know is not going to happen. So the choices are really to ration and redesign, and health systems have tried rationing. We've done delisting, we've revisited contract negotiations with healthcare providers. So that really brings us to redesigning or re-engineering the system and really thinking about how you create the conditions to be able to drive innovation adoption, to be able to test it and evaluate it effectively, to be able to address some of these challenges. Thank you.